All right, so today we're taking a deep dive into hyperthyroidism. We've got some really interesting excerpts from an up-to-date article on diagnosing this condition.
Yeah, this is going to be fun.
It's going to be like a detective's case file
So, but
for your thyroid.
I like that. Unraveling the mystery.
Okay, so first things first. Let's imagine you're the patient. How would you even know something was off? What does hyperthyroidism actually feel like?
Well, imagine your body's engine. Like it's stuck on fast forward. The up-to-date article uses some pretty vivid descriptions like anxiety, tremors, a heart that just won't stop racing, and get this, you might be losing weight, even with a bigger appetite than usual.
Whoa, wait. Really? You mean you could be eating more but still losing weight? That seems a little counterintuitive.
It is, but think of it this way. Your metabolism is just on overdrive, burning through calories like a furnace. So you're hungry all the time. Your body's demanding more fuel, but it's still not enough to keep up with that accelerated energy expenditure.
So if you're experiencing any of those symptoms, definitely a sign to get checked out. But the article also mentions that these symptoms can be subtle, especially in older adults.
Right. It's like their bodies aren't sending out the same SOS signals.
Right.
Exactly. So it's important to be aware of the full spectrum of symptoms and not just dismiss any changes you notice. And that's where the lab tests come in. They're like the magnifying glass to
Yeah.
see what's really going on.
Speaking of those lab tests, the source mentions TSH, free T4, and T3 as the key players here. Can you walk us through what those are and what they tell us?
Absolutely. Think of TSH, or thyroid stimulating hormone, as your body's internal thermostat for thyroid activity. So if your TSH is low, it's like your body's saying, hey, the thyroid is already pumping out too much hormone. Someone hit the brakes.
Yeah, so low TSH.
Yeah.
First clue that something might be up. And then T4 and T3, those
Yeah.
are the actual thyroid hormones, right?
Exactly. And they're usually elevated in hyperthyroidism. But here's where it gets interesting. The article mentions this thing called T3 toxicosis. It's a situation where T4 levels might be normal. So if the doctor's only looking at that, they could miss the diagnosis completely.
So if you're getting tested, you need to make sure they're looking at the whole picture, not just a single piece of the puzzle. It's like making sure you're getting all the right clues.
That's a great analogy. And it highlights why it's so important to be an informed patient. Advocate for yourself. Don't be afraid to ask questions and make sure you're getting the most comprehensive testing possible.
So we've seen how tricky diagnosis can be.
Hmm.
But why does the thyroid go haywire in the first place? What's triggering this whole thyroid roller coaster?
Well, the source lays out several possible culprits. Graves' disease is a big one. That's where your immune system mistakenly attacks the thyroid, causing it to overproduce hormones.
And that's the one that can cause those eye problems, right?
Mhm.
The article mentioned bulging eyes, which sounds pretty alarming.
You're thinking of exophthalmos. And yes, it's a classic symptom of Graves' disease. The eyelids can also retract, giving the eyes a staring appearance. And there can be double vision, even pain and discomfort.
Ooh, that doesn't sound fun. Okay, what about those toxic nodules? Are those like little hormone factories gone rogue?
Exactly. They're lumps in the thyroid that start producing excess hormone independently of the rest of the glands.
So it's like a little mutiny
Yeah.
happening right there in your neck. And then there's thyroiditis, that's inflammation, right?
Yeah.
But wouldn't inflammation usually make things slow down?
Mhm.
I'm a little confused how that leads to hyperthyroidism.
You're right. Inflammation usually means things are calming down. But in certain types of thyroiditis, it actually causes damage to thyroid cells, releasing stored hormone all at once.
Ah, so it's like a sudden flood of hormones.
Yeah.
Rather than the thyroid actively making more.
Exactly. And there are different types of thyroiditis, some painful, some not. They can even be triggered by things like viral infections or certain medications.
So even within these main causes, there's a ton of variations.
Yeah.
Each case is its own unique puzzle.
Absolutely. And to crack the code and figure out the right treatment, we need more than just a yes or no answer to the question, do you have hyperthyroidism?
Mm.
We need to understand the specific type you're dealing with.
Okay, so let's dive into those different types. We've got overt, subclinical, T3 dominant, T4 dominant. Seems like there's a whole other layer of complexity here.
You're not wrong, but don't worry, we'll break it all down for you in part 2. It's like we're adding more pieces to our thyroid puzzle.
Stay tuned, everyone. We're just getting started.
All right, so we're back with more pieces to our hyperthyroidism puzzle. Remember those different types we mentioned?
Yeah. We left off with overt, subclinical, T3 dominant, T4 dominant. It's a lot to keep straight.
It is a lot.
Let's start with overt hyperthyroidism. Is that what most people picture when they hear hyperthyroidism?
Yeah, I think so. Overt hyperthyroidism is like the textbook case. You've got those noticeable symptoms, and your lab tests clearly show elevated thyroid hormones. along with a suppressed TSH. So it's a pretty straightforward diagnosis.
Okay, so that's the obvious presentation. What about subclinical hyperthyroidism? How is that different?
Well, this is where things get a little trickier. In subclinical hyperthyroidism, the TSH is low, so we know something's up. But the actual thyroid hormone levels, the T3 and T4, are still within that normal range.
So you might not feel all that bad.
Right.
The article mentioned that subclinical hyperthyroidism often gets picked up during routine blood work.
That's right. And it's important to catch it, even if you're not experiencing a ton of symptoms. You see, even though it's called subclinical, it can still have long-term consequences, especially for your heart.
Speaking of consequences, the source also mentioned atrial fibrillation. That irregular heartbeat is more common in older folks. With subclinical hyperthyroidism,
Yeah, that's a key point. Atrial fibrillation, or AFib for short, can increase the risk of stroke and other heart problems. The connection between subclinical hyperthyroidism and AFib is still being researched, but it's definitely something to be aware of, especially if you're in that age group.
so even if you're feeling pretty good, getting this checked out could be crucial for your long-term health. It's like preventative maintenance for your heart.
Exactly. Now on to those T3 and T4 dominant types. Remember how we said those thyroid hormones can present in different patterns?
Yeah.
Well, sometimes one hormone might be significantly more elevated than the other.
Okay, so it's not just about whether the hormones are high,
Huh.
but also about their relative levels to each other.
Precisely. And that's where those T3 dominant and T4 dominant classifications come in. It's not just an academic distinction either. It helps guide treatment decisions because different medications target those different hormones.
So it's like knowing whether you need antibiotics or antivirals, the right tool for the right job.
Yeah.
So each little detail adds another layer of insight into the diagnosis and treatment plan.
Absolutely. It's like building a more complete picture of what's happening in your body. Now let's circle back to those causes of hyperthyroidism. We talked about Graves' disease, toxic nodules, and thyroiditis. As the more common culprits, you mentioned you were researching this for a friend, right?
Yes, that's right.
Well, knowing these different causes can help you understand what they're going through and ask more informed questions about their treatment.
Okay, let's start with Graves' disease. I know that's an autoimmune condition.
Yeah.
It always sounds a bit mysterious to me what's actually happening there.
So in Graves' disease, your immune system, which is supposed to protect you, mistakenly attacks the thyroid gland. It's like friendly fire, causing the thyroid to go into overdrive and produce way too much hormone.
And we talked about those eye symptoms earlier. That's a hallmark of Graves', right?
Exactly. It's not always present. But when it is, it can be quite striking. We're talking bulging eyes, eyelid retraction, double vision even, pain.
Yikes. Not something you want to mess with.
Okay, what about toxic nodules? Those sound like little troublemakers.
They are. A toxic nodule, or hot nodule as it's sometimes called, is a lump in the thyroid. That decides to go rogue and start producing excess thyroid hormone on its own.
So it's like a little hormone factory operating outside the rules.
A perfect analogy. And then we have thyroiditis, which is inflammation of the thyroid. Now, you might think inflammation would slow things down, but in certain types of thyroiditis, it actually damages the thyroid cells, causing them to release stored thyroid hormone all at once.
Ah, so it's like a sudden surge of hormones, as opposed to the thyroid constantly producing too much.
You got it. And just to add another layer of complexity, there are different types of thyroiditis, some painful and others painless. They can also be triggered by various things like viral infections or even certain medications.
Wow, thyroiditis is more complex than I realize. It seems like every time we peel back a layer of this hyperthyroidism onion, we find even more layers underneath. It's true. And that's why we need to consider all these nuances when diagnosing and treating hyperthyroidism. Now remember those rarer causes we mentioned, pituitary tumors and T3 resistance.
Yeah.
Should we explore those a bit?
Yes, let's do it. I'm curious to learn more about those less common scenarios, especially since this information could be helpful for my friend as they navigate their diagnosis.
Great point. Understanding the full spectrum of possibilities can empower both patients and their loved ones. So let's talk about pituitary tumors first.
Okay, remind me, what's the pituitary gland's role in all of this? I know it's somewhere in the brain, but I can't quite recall its connection to the thyroid.
It's all about that TSH hormone we discussed earlier. Remember, TSH is like the messenger. That tells the thyroid how much hormone to produce. The pituitary gland is the one sending those messages. Now, in some cases, a tumor can develop in the pituitary gland, and some of those tumors can actually secrete TSH.
Ah, I see where this is going. So instead of the pituitary putting on the brakes, when thyroid hormone is high, it's actually stepping on the gas.
Precisely. It's like the thermostat is stuck on high, no matter what the temperature is. And as a result, the thyroid keeps churning out more and more thyroid hormone, even though there's already plenty circulating.
Wow, that's fascinating and a bit scary. Okay, what about T3 resistance? What's going on there?
T3 resistance is a genetic condition where the body cells don't respond normally to the T3 thyroid hormone. This can lead to a buildup of T3 in the blood, even though the thyroid itself might not be overactive.
So it's not a production problem,
Yeah.
but rather a utilization problem.
Exactly. It's like having a delivery truck full of packages, but no one's there to unload them. And as you might imagine, this can present in different ways. Some people with T3 resistance might have minimal symptoms, while others might experience those classic hyperthyroid symptoms we talked about earlier.
It's amazing how many variations there are within hyperthyroidism.
Yeah.
It really highlights how important it is to have a skilled doctor who can connect all the dots.
I couldn't agree more. It's not just about ordering tests, but about interpreting them in the context of the individual patient. And speaking of tests, remember that radioiodine uptake test we mentioned earlier?
Yes. The one that helps differentiate between the thyroid making too much hormone versus just releasing stored hormone due to inflammation. That seems like a crucial piece of the puzzle.
It is. It helps us determine whether the thyroid is the primary culprit, or if something else is driving that excess hormone release. This information is essential for guiding treatment decisions.
Okay, so we've covered a lot of ground here, from symptoms to causes, different types, and even those crucial diagnostic tests. But before we wrap up this part, can we give our listener a little preview of what treatment might involve? I know we're focusing on diagnosis, but I'm curious about what happens next.
Of course, treatment for hyperthyroidism really depends on the underlying cause and the severity of the condition, but generally the goal is to reduce the amount of thyroid hormone circulating in the body, bringing things back into balance.
That makes sense. What are some of the ways that's typically done?
Well, there are a few main approaches. One option is anti-thyroid medications, which work by blocking the thyroid's ability to produce hormone. It's like turning down the volume on that overactive thyroid.
Okay, so it's a direct way to address the overproduction. What else is there?
Another option is radioactive iodine therapy, which involves taking a pill or liquid that contains radioactive iodine. This iodine is absorbed by the thyroid, and the radiation destroys some of the thyroid cells, reducing hormone production.
That sounds a bit intense. Is it a common treatment?
It is, and it's generally safe and effective. It's often used for Graves' disease and toxic nodules. And then there's surgery, where a portion or all of the thyroid gland is removed.
I imagine surgery is usually reserved for more severe cases or situations where other treatments haven't been successful.
That's right. It's also sometimes used for large goiters, which are those enlarged thyroid glands that can cause discomfort or difficulty swallowing, or when there's a suspicion of thyroid cancer.
So the treatment landscape is just as diverse as the causes and presentations of hyperthyroidism. It really underscores the need for personalized care.
Absolutely. It's all about finding the right solution for each individual's unique situation, taking into account their symptoms, test results, and overall health.
This has been an incredible deep dive so far. We've explored the intricate workings of the thyroid and uncovered the complexities of hyperthyroidism. But don't go anywhere just yet. There's more to come in part 3.
You won't want to miss it. We'll be wrapping up this deep dive with a final thought-provoking question that'll have you pondering the bigger picture of thyroid health.
Ooh, I love a good cliffhanger. Stay tuned, everyone. We'll be right back.
All right, and we're back for the final part of our hyperthyroidism deep dive.
Ready to wrap things up?
Absolutely. We've covered a lot of ground, symptoms, causes, different types.
It's been quite the journey.
It has. But you mentioned a final thought-provoking point from the source material. What is it?
Well, the up-to-date article mentions that as we get older, our TSH levels naturally tend to run a bit lower. Okay, so their baseline's a little different. How does that impact things?
Well, it raises an interesting question about overdiagnosis, specifically when it comes to subclinical hyperthyroidism. In older adults,
I see where you're going with this. So if their TSH is already on the lower end of normal for their age, could we be misinterpreting those readings as subclinical hyperthyroidism when it's actually just part of their normal aging process?
exactly. It's a nuance that highlights the importance of looking at the whole picture, not just isolated lab values.
So age isn't just a number when it comes to thyroid health.
Precisely. We need to consider age, overall health, other medical conditions. It all plays a role.
Well said. This has been an incredibly insightful deep dive. Big thanks to you for guiding us through this, all the complexities of hyperthyroidism.
My pleasure.
And to our listeners out there, we hope this deep dive has given you a solid understanding of hyperthyroidism, from how it feels to how it's diagnosed and what might be causing it.
And remember, knowledge is power. The more you understand about your health, the better equipped you are to have informed conversations with your doctor and make decisions that feel right for you.
Couldn't agree more. Keep asking questions, stay curious, and never stop learning. That's what the deep dive is all about.
Until next time, keep exploring.